Healthcare. It's the big topic on everyone's minds these days. Healthcare is a vital part of communities in both urban and rural areas, and not just for everybody's health. In the Twin Cities and all over greater Minnesota, hospitals and clinics are among the largest employers in their regions and are major contributors to their local economies. But across Minnesota, healthcare services in small towns and small cities have been quietly going away. Since 2005, 7 hospitals in greater Minnesota have closed. Why is that? The reasons are complicated, but a big part of it has to do with the rising costs of healthcare and the policies created to control those costs. For decades, we've had a fee-for-service system in America. Hospitals and clinics were paid based on the number of services, procedures, and tests they provided for patients. But that didn't work out so well. Americans didn't seem to get much healthier, and costs kept spiraling upward. Now those paying for our healthcare, especially the federal government, are switching to a new philosophy, one that pays providers based on quality instead of quantity. Under this new value-based system, healthcare providers are paid a flat amount based on how much a patient's treatment should cost. If the actual cost of treatment goes over that amount, the provider loses money. If the patient does well and the provider can keep expenses down, they make a profit. That may sound a little like healthcare trying to do things on the cheap, but if you consider that a healthier patient spends less time at the doctor than an unhealthy one and uses fewer services, it starts to make sense. Healthier patients mean lower expenses. But not every patient can be healthy and low cost. That's why the key ingredient in this new efficiency game is a large patient pool. Having more patients lets a healthcare provider mix the financial risk of a few high-cost patients in with the larger pool of low-cost patients, which lowers the average cost overall. But it's hard for rural healthcare providers to build a large patient pool when they're serving a small population spread over a large area. And because rural patients tend to be older and older patients tend to need more care, it's harder for that small patient pool to keep the average cost down. That makes it hard for rural hospitals and clinics to win in the new value-based system. Medicare and Medicaid do help somewhat. Many rural hospitals are designated critical access hospitals, which entitles them to higher payments from the federal government. But it's not always enough. A review of hospital financials shows that rural hospitals routinely post very small profits or even lose money year after year, while urban hospitals generally make a profit. To survive, many of Greater Minnesota's hospitals, clinics, and physicians have been turning to healthcare systems looking to grow their patient pools. Joining a large healthcare system gives small providers access to specialists, technology, and funding that they wouldn't have been able to get on their own. But even within a big healthcare system, small rural hospitals are still less efficient and more expensive to operate. To keep costs down, healthcare systems have been moving the more specialized and expensive services out of their small rural facilities and offering them only at their large urban ones. And sometimes those rural hospitals and clinics are just too expensive, so they close altogether. The result? Rural patients find themselves having to travel farther to access healthcare, especially for inpatient services and specialists. So it turns out the policies that were supposed to be helping make healthcare more accessible for everyone in terms of costs are the very policies making healthcare less accessible in terms of travel for rural residents. What can we do to keep vital healthcare services available to rural Minnesotans? Well, here are some recommendations for lawmakers. Require healthcare systems to explain why they want to remove services from a community and calculate how the change will impact access for the people affected. When developing cost-cutting requirements, instead of looking at a healthcare system as a whole with a single bottom line, consider that the individual facilities within each system may differ a lot by size, and that has a big impact on just how much a facility can cut costs. Cost-cutting policies that are doable for a large urban hospital could cripple a small facility. Explore alternative revenue streams for rural hospitals. They may not be able to provide some services as well as large hospitals, but there could be other services they excel at. And ensure that communities have input into the decisions made about their healthcare. We all need healthcare services, so we all need to keep the system healthy and accessible for our families, for our communities, and for the generations to come. To read our full report and to learn more about the Center, visit our website at ruralmn.org.